7 signs of infertility in men you should know about. But even if a baby is not on your mind, here are some of the alarming signs of infertility in men you should be aware of. 1. Pain and swelling in your testicles. Always check the health of your testicles, whether there is a certain tension, swelling, or even a lump, because this could be an indicator of varicocele. This condition relates to the enlargement of the testicle veins, quite like varicose vein, leading to a lowered sperm count and subsequently hampering the delivery of sperms. If your pain is too acute, consult your doctor. There are surgeries in order to fix the clumped veins. By ignoring this, you are cutting down on your chances of becoming a daddy. 2. Poor sense of smell. Now, this may not always be a foolproof indicator of infertility, but surely one of the signs of infertility in men. Usually this condition relates to a disorder that is passed down genetically called Kallman's syndrome, an extremely rare disorder in which your puberty never took off, or you are still in your puberty phase despite your years. As a result of this condition, you are totally immune to smells, and you cannot discern one smell from the other. This usually leads to the malfunction of the testicles and erectile dysfunction, and of course lowered sex drive. If you have had this condition for the longest time you can remember, and not because you recently caught a cold, visit your doctor. 3. Difficulty in ejaculation. This is a rather common sign of infertility in men, and it is referred to as ejaculation disorder. In this condition, either you ejaculate in fits and starts, or very low amount of sperms come out when you do, and is a grave cause of concern if being a parent is your priority. Sometimes retrograde ejaculation could be a cause for this great difficulty in ejaculation, because this condition draws the semen backwards to the bladder, rather than out of it. Some medicines are responsible for giving you this condition, while it can also be a neural problem. Either way, you shouldn't have difficulty ejaculating. 4. Low sperm count. Low sperm count is among the sure-shot signs of infertility in men, because if the sperms are not sufficient, it will not help the egg to fertilize into an embryo. You can't ascertain this at home, but if you have been having unprotected intercourse for about a year and still trying to have a baby, then you are suggested to take a test to ensure your sperm count isn't poor. Typically any lesser than 15 million sperm per milliliter of semen is a low sperm count. It ideally should hover between 20 and 150 million sperm per milliliter of semen. There are several factors that can be attributed to a lowered sperm count, such as chemical exposure, an imbalance of hormones, and infection in the testicles. Sooner you see your doctor, the better. 5. Your testicles are smaller than usual. This is again a very rare condition, also called the Klinefelter's syndrome, sometimes even genetic, when you are born with smaller testicles. Small testicles cause insufficient production of sperms needed for the fertilization of the egg. Predominantly, during puberty they are too tiny for the production of testosterone. This condition should be treated in your teen years, or you will have to seek the help of a genetic expert in infertility. 6. Low sex drive. Of course, you could be too tired on days to have sex, and we are not calling that low sex drive. But in general, if you do not have the urge to have sex, or you never initiate sex with your partner, you have a cause of concern here. This is among the definite signs of infertility in men. If your testicles are not producing enough testosterone to stimulate you enough to have an intercourse, you need to fix an appointment with your doctor. You cannot father a child if you are slowly going off sex. Get this checked before it is too late. 7. You are growing breasts. Gynecomastia results in a swelling in the breast tissues in men due to an imbalance in the sex hormones, androgen and testosterone. This leads to an enlargement in the breasts. If you have noticed your breasts growing, and that too disproportionately, you could be suffering from this condition, which will prevent you from having a baby. It is a major cause of male infertility, but it can be corrected provided you seek help at the right time. If you have noticed any of these signs of infertility, In men, visit your doctor. Baby or no baby, it's always better to get such symptoms corrected and stay healthy. Thank you for watching the video. Please subscribe my channel for more videos. 7 warning signs of infertility in women. We discuss the 7 major signs which are a definite indicator of infertility in women. 1. You have always had irregular periods. Now, do not make peace with this sort of a situation. If your periods do not follow the stipulated 21 or 35-day cycle, you need to be wary. Because, if nothing else, irregular periods indicate that you are not ovulating every month. This is among the sure-shot signs of infertility in women, though such a condition can be treated, provided you raise the alarm earlier on. You need to ovulate regularly to get pregnant. Statistics show that irregular ovulation is the primary cause of female infertility. There are treatments to cure this condition, and if you intend to get pregnant in the future, initiate now. 2. Your periods have suddenly stopped. Now, if you are not a menopausal woman, and also not under any medication to delay or temporarily stop your periods, be very concerned. Your periods in such a situation shouldn't naturally stop, for stopped periods mean no ovulation, and if you are not going to ovulate, you shall not get pregnant. Ovulation is crucial to pregnancy, and halted periods is among the clear signs of infertility in women. Immediately consult your gynecologist and start on the requisite medication. Of course, there is treatment for stopped periods. 3. Your periods are very heavy. The flow of the vaginal blood should be moderate. Anything above that, which normally keeps you in bed, is a cause of concern. Heavy periods are an indicator of no ovulation, because the release of the egg from the ovaries triggers the production of the hormone progesterone, which is responsible for giving you healthy periods. Now, when you don't ovulate, the lack of this progesterone leads to extremely heavy menstrual blood flow. This is a definite hindrance in your pregnancy plans. Notice this trend in your periods for a few months, and if they are consistently heavy, you need to see your doctor at once. 4. Pain during sex. Either your periods are very painful, or you experience pain every time you have an intercourse. These can be veritable signs of infertility in women. Have you noticed blood in your urine, or you have terrible rectal pain? All these are conditions of endometriosis. Stats show that about 7 billion women in the USA suffer from this condition, and of them about 40% turn out to be infertile because you have an extremely difficult time trying to get pregnant. Endometriosis can be treated, and hence observe your body. And don't feel shy to talk to your doctor. 5. Growth of unwanted, dark hair on your face. If you notice of sprouting of thick, coarse body hair on all parts of your body, this could be an indicator of PCOS or polycystic ovarian syndrome. PCOS is generally a condition in which a woman's sex hormones, progesterone and estrogen, are way off, which often leads to the formation of cysts, though benign, in the ovaries. PCOS have a bearing on a horde of things, such the functioning of your heart, your menses, and most importantly, your fertility. There are several factors responsible for PCOS, such as the overproduction of the male sex hormone, androgen, genetic conditions, among others. But PCOS are among the important signs of infertility in women, so without losing time, get yourself checked. 6. You are losing excessive hair on a daily basis. Well, now, hair loss is not a definite indicator of infertility in women. There are several environmental and internal factors that can be attributed to hair loss, and infertility being one of them. An unchecked thyroid could be a reason for hair thinning or hair loss, as are anemia, autoimmune diseases, and psoriasis. Again, an important cause of sudden shedding of hair or abnormal hair thinning is undiagnosed PCOS. Observe your body closely. If your hair loss issue is grave and sudden, fix an appointment with your gynecologist, for it is going to affect your chances of getting pregnant in the future. 7. Poor sex drive. Either you are having extremely painful sex, or you have genuinely lost interest in sex, both are conditions that need some mulling over. Stress, depression can often be the cause of a plummeted sex drive, and not to mention, there are a host of medical conditions contributing to the same, including infertility. If you are not going to have natural, healthy sex, you are not going to conceive your baby. Not going to have natural, healthy sex, you are not going to conceive your baby. So, don't leave it off as just another phase. A drastic drop in sex drive can never be normal, and be informed. You need to consult your doctor about this. There are superb treatments to get it back up and running. We sincerely hope you are not suffering from any of these conditions, and even if you are, there is no need to panic. All these conditions, while they are signs of infertility in women, can well be treated if you attend to them soon enough. Thank you for watching the video. Please subscribe my channel for more videos.